Assalamu alaikum warahmatullahi wabarakatuh. Hello, Joanna Club listeners. Today's topic is about the influence of two hemostatic agents, the epinephrine versus aluminum chloride, on the periapical surgery healing outcome, which was assessed in this 12 months prospective randomized clinical study conducted by Penarrocha Diago and colleagues in 2018 at the University of Valencia in Spain. They had two aims. The first one was to evaluate the influence of these two hemostatic agents on the outcome of the surgery, and the second aim was to relate the efficacy of hemostatic agents at the time of the surgery with also the healing outcome. Several other variables have been associated with favorable prognosis after epiectomy, including the absence of signs and symptoms, the lesion size, the root and filling material, etc. However, the influence between the hemostatic agent used and the outcome after the periapical surgery has not been studied. For the materials and methods, they included periapical lesions involving a single tooth with a diameter that's less than 10 millimeters in patients with at least 12 months follow-up, and they excluded cases that had apicomarginal defects, periapical pathology that's associated with vertical fracture, cases where the hemostatic agent did not allow the placement and the setting of the retrograde filling with no hemorrhage control at all, and patients on anticoagulants. So they included 120 patients assigned in two parallel groups depending on the hemostatic agent used, either the gauze impregnated with the epinephrine of 1 milligram per milliliter compressed against a bony crypt for 2 minutes, or aluminum chloride in a paste form applied for also 2 minutes. They had a block randomization scheme that was generated using a randomization website, and the assignment was concealed from the investigator until the moment of the hemostatic agent application by an opaque envelope, and the surgical field was photographed before and after the application of the hemostatic agent. The bleeding was then assessed by the surgeon at the time of the surgery and by two independent investigators through the photographs. The bleeding control was classified as follows: 0, no hemorrhage control that compromised the root and filling procedure; 1, slight but apparent intermittent bleeding that allowed the root and filling procedure; and 2, complete hemorrhage control. The healing was also determined clinically and radiographically according to the scale of von Arx as follows: either successful or healing or failure. For the results, the aluminum chloride group had a 68% cases classified as successful, while the epinephrine group had 62%. And although the difference was not statistically significant, the outcome was superior in the aluminum chloride group. The study found no association between the use of epinephrine or aluminum chloride as hemostatic agents on the healing outcome. They also found that the efficacy of the hemostatic agents, either complete hemorrhage control or slight bleeding, showed no relationship with the healing outcome. The study had two limitations. Other than the obvious short follow-up period of 1 year, there was a difficulty in defining the boundary between complete hemorrhage control and slight but intermittent bleeding. Another limitation is that only small-sized lesions with a diameter that's less than 10 mm were studied, therefore the outcome should be interpreted with caution. And finally, to conclude this, the clinical relevance of this investigation is to address a possible doubt faced by clinicians about which hemostatic agent should be used. Although there was no association between the hemostatic agent type and efficacy on the healing outcome, now we have an idea that both of these hemostatic agents options offer adequate bleeding control with comparable efficacy that can be utilized along with other supplemental techniques, which essentially reduces the operating time, improves the vision in the surgical site, and is crucial for the placement as well as setting of the retrograde filling. And that's all for today. Thank you so much for listening. Hope you have a wonderful day. Bye.